We're our host, Sherrie Price Clark of Storehouse Media. Sherrie, this guest impresses the heck out of me, has groundbreaking treatment, and I love having doctors on the program. Who's our guest today?
Our guest today is Dr. Michael Louwers. He is a double board certified physician and the medical director of Reset Medical and Wellness Center in Strongsville, Ohio. Hi, Dr. Flowers. Good
Hi,
to
hi
have you.
guys. Hi, Neil, Sherrie. Nice
Hi.
to be
How
Yes,
on.
are
thank you
you?
again.
Doing well, and happy early holidays here, and Merry Christmas and New Year to everyone as well.
All right.
Merry Christmas to everyone too. Yeah. Well, we're excited on having you because of what you're doing, this groundbreaking medical treatments that you're providing for people who have PTSD and other situations. You were talking about that. You saw how science and compassion together can open doors for people who feel stuck or overlooked. And your greatest reward comes from walking alongside patients as they discover hope, resilience, and the possibility of living whole again. So I think when you have these kind of situations like PTSD, you go through life and you think, I'm the only one, no one will ever understand me. And you just kind of pick up the ball and like, not only do we understand you, but we know how to help.
Yeah,
And
that
that's a
is super
huge thing.
common. Yeah, no, that's absolutely very common. Historically, people think of post-traumatic stress as being, physical assault, military trauma, but the reality is, post-traumatic stress is a lot more common. It comes from childhood neglect. It comes from social stressors. It comes from, socioeconomic issues, from upbringing, from adolescence, from bullying, from divorce, really common things that unfortunately are overlooked and people don't realize when they start having these symptoms, that's what it is. And they think they're just having, panic attacks or a different form of anxiety. And it's really because of the trauma that they've been through.
So, talk about the symptoms. I had a guest on, a client who had PTSD, and he had severe. He was fire department, had a really bad situation, and he had to resign from the position and went down that trail. And he found out from childhood it started. So, kind of dive deeper into explaining, what are the symptoms and signs, especially if it happens later in life.
Yeah. So there's a wide variety of symptoms, but they all stem from a similar root cause, which is a overactive fight or flight response, right? So think of it this way. Humans are really good to adapting to their environment, right? So like if you move to Denver at high altitude, your body acclimates to that. And if you're there long enough, then, things start to change physiologically. So you don't get altitude sickness anymore, right? The same process occurs when we're exposed to stress or trauma. So our body acclimates to that situation so that we can adapt and survive in that environment. And the more severe the stress, the longer that duration of stress occurs, the more profound this change becomes. And this fight or flight system is intended as a kind of short burst release system, right? Like there's a bear charging you. What are those feelings that you would get? Well, your heart would get racing, adrenaline surging, panic and restlessness. Those are the types of symptoms that people get, but their nervous system then locks these symptoms in. And so this fight or flight response becomes the default response to any and every situation. And so people suffer from irritability, short fuse, hair trigger temper. They suffer from insomnia and restlessness and nightmares. They suffer flashbacks. They have mood changes. And sometimes as extreme as things like paranoia and hallucinations. And you can imagine having those symptoms all the time, even without that stress or trauma being around anymore, is really disconcerting. And these folks, unfortunately, even when they're put into a healthy situation, an environment that's supportive, the symptoms are still there, and our brain just starts to make up these cues and triggers in our environment that are seemingly benign, like a sound that you hear or a discussion that you have with your spouse, or just your mind wandering. And it triggers this fight or flight response, the same physiologic reaction, and then these symptoms continue. And it's a very difficult cycle to break.
It definitely is a difficult cycle, and it's got to be a situation. So, what is severe PTSD versus less severe, where you really don't have to concern about it, but you do have signs of PTSD?
Well, I mean, if you're talking about just early signs, it will probably mimic anxiety. You might have racing thoughts. That's a common one. You might have even what you might consider productive symptoms early on. So we see this a lot in folks that are successful in business. Someone like yourself is probably maybe a type A personality and sets the bar high for themselves, right? And you're very organized, and maybe you have trouble not doing things yourself. You want to do everything yourself and not let anyone else do anything because you do it just right, right? And that mentality is often rooted in anxiety and fight or flight response. And a little bit of that can be helpful, right? A little bit of stress is helpful. But as that accumulates, we hit that point where it's no longer helpful, and you hit things like burnout and exhaustion. And that's when real anxiety and real significant symptoms start to set in. And it'll often correspond with physical symptoms too. So people might have some GI issues, maybe some muscle tightness and soreness and joint pain and achiness, maybe some chest tightness. And of course, you want to get those, worked up with your doctor, but often, unfortunately, there's no root cause that's found, and it's, attributed to, oh, it's nothing, just, it's just stress, exercise more, and the underlying trauma then continues.
Wow. What do you think, Sherrie?
Boy,
Yeah.
yeah, it is it is a condition, and I wonder how many people walk around exhibiting, feeling those symptoms and not even a clue. Again, it's back to
Yeah,
anxiety.
it's huge numbers. It's 12 million people in the United States right now suffer from post-traumatic stress, and that's the number that are diagnosed. But like I said, that number is probably significantly underrepresented. There's a lot more folks that are walking around with, like you said, kind of early symptoms, or maybe not diagnosed yet, or just ignoring these symptoms. And unfortunately, we're so specialized in the medical system that, you go to see that cardiologist and you get the good heart workup, and it's, thankfully it's not your heart, but then they're like, oh, well, I don't know what it is, so good luck to you, right? And you see the GI doctor and they say, the same thing. Oh, well, your scope looked good. I can't figure out why you're having these digestive issues. Good luck to you. Maybe it's stress. Good luck. And often the mental health aspect is pushed aside or ignored, not intentionally, but just that's kind of how the system funnels patients now, a volume-based system.
Mm. And the problem is that system leads to more and more issues because you think it's a health issue when it literally is something involving stress. And how do we decrease stress? So you did mention certain things that I think I was suffering for more a couple years ago as I'm finding myself than now, where I'm kind of like able to depart when something goes wrong, to take a deep breath, realize what's happening, and move forward with the next activity. Saying, hey, next thing's going to be good. I'm all right. And that's entrepreneurship. And you see probably a lot of entrepreneurs that
Yeah,
suffer with some signs of PTSD. But then identify
absolutely.
that you think it's the end of the world. You're on you're ready to jump off, and meaning your business is done. Then 3 days, 2 days later, the world's all great again.
Yeah, yeah, yeah. And you set that bar really high for yourself. and you're your own worst critic, right? You're really hard on yourself when things don't go right, or when you make a mistake, and that's very self-destructive. So we have to be aware of it. But that's a good thing. Once you're aware of it, you can make appropriate changes to mitigate that stress and to focus on some self-care. And that can certainly prevent that from getting worse. And yeah, sometimes you need more treatment than just self-care and mindfulness, but at least that's a start.
So it sounds like all PTSD involves anxiety. And does all anxiety mean PTSD?
They're very closely linked. So anxiety, post-traumatic stress, and depression are all very closely linked. It's hard to completely separate those. And you'll see other conditions that are also kind of, under the same umbrella, whether it's eating disorders, obsessive compulsive disorders, even bipolar has a lot of overlap with post-traumatic stress. So, those, of course, need to be diagnosed by a mental health professional. But I can tell you with certainty there is a lot of overlap, and it kind of makes sense, right? If you have trauma in your past, you are more likely to have a unhealthy relationship with, in social settings, with your spouse, with your kids, unless those issues are dealt with. And so that will then lead to anxiety and depression. And so we survey for all those things when we take in a patient, and very commonly we'll see at least scoring in the mild to moderate for all three of those categories.
And we're going to get to the treatment in a second, but
Sure.
I look at this and say, all of us has some sort of signs of PTSD. Is that correct? Most people.
I'd say a lot of people have some level of trauma in their past and some symptoms of post-traumatic stress. Now, whether they qualify clinically for that is a
No.
different story, but a lot of people have symptoms of post-traumatic stress. And a lot of people, like we said, just don't realize it. And right now in medicine, there's far too many band-aids, right? There's too many symptomatic treatments. Oh, you have panic attacks, here's your Xanax. You can't fall asleep, well, take this sleeping pill. And I'm not against medications. I think medications have their place. I prescribed medications for a lot of years. But I think it's far too prevalent in our medical care that we're just throwing medications at every symptom under the sun without making a good diagnosis and treating root cause.
Yep.
Well, I think root cause is the operative word here, right? Instead of, putting the Band-Aid on. And you have more than a Band-Aid, don't you? I
Yeah,
mean, you have something that you can offer people, whether it's military, law enforcement, or people who think, because I think PTSD a lot of times associated with law enforcement and military, but it can happen to anybody. And you
yeah.
have a way to help them. And that's what I find so super exciting.
Yeah, no, we do. So my background, to touch base on that. So I came to this place because I started in Michigan. I started my career in Michigan. Don't hold that against me. You guys are, I think, from Ohio, right?
I'm Ohio. She's Florida, but
Oh,
I'm
okay.
not from Ohio. I'm
Not
Pittsburgh,
from
so
Ohio.
I don't. I'm not gonna.
Okay, all right,
I'm not
good. Then you
gonna.
won't hold it against
Yeah,
me.
I won't. I won't. I have good memories of
Oh,
Michigan, so don't worry.
all right.
So
In that case, go blue. So,
no, no, it was more out in Grand Rapids. My.
oh, very good, very good.
Yeah.
So when I moved to Ohio, it was kind of at the peak of the opioid epidemic, and I did a lot of my early career in addiction medicine, as well as a lot of chronic pain. And my frustration was just was that I was not able to treat the root cause, that we would see a lot of patients relapsing, a lot of ongoing symptoms that we were just putting Band-Aids on. And so a couple years ago, I partnered with a couple other folks to start this center because we had learned about a treatment that could really be helpful as a root cause treatment for post-traumatic stress and anxiety disorders. And so that's how Reset Medical and Wellness came about. And and it's really taken off. And like you said, it's not just about military and first responders. That's about 30–40% of our clientele is that. But, the other 60% are just, folks like you and I that are struggling and maybe weren't diagnosed formally with post-traumatic stress, but they recognize that they've had trauma and they're having all the clinical signs and symptoms.
Right.
Um, so, I can certainly tell you about the treatment. So the idea, as I mentioned earlier, is that these folks often have this fight or flight response that is stuck in overdrive, right? Think of it like, a gas pedal on a car, and it's just pushed to the floor. And they're even hitting that little Fast and the Furious button occasionally, the little nitrous button, right? And that's just revving them up constantly. And the system that controls that is called our sympathetic nervous system. And lucky for us, it has an on-off switch. And it's a collection of nerves here in our neck called the stellate ganglion or sympathetic chain. And if I numb that, if I do a nerve block, I pause that system temporarily, it allows the system to then recalibrate back to its baseline. So essentially taking the pedal off the floor, allowing you to hit the brake. So your response to your environment, to stressors, is no longer at a 10 all the time. It's not that everything is this high intensity need for, this threat response system. And you can respond to stressors in a more healthy way and integrate treatments like traditional treatments like therapy and mindfulness more effectively. And so this block, while it was done for 100 years for pain, it was discovered about 20 years ago or so that it could help these symptoms. And in the last 20 years, there's been great research, some of which that I've been a part of, that has really transformed the landscape of post-traumatic stress treatment.
Wow. And I think that what you've have been able to develop, it works. And you can't give medical claims, but you can, I don't know if you can or not, but you really have, your patients have seen some great signs of recovery in certain aspects, right?
Yes, we have seen amazing results. So clinically, looking at research and even research that my colleagues across the country have done, we're seeing about a 70–80% success rate. In other words, about 70–80% of people respond well to this treatment. And anecdotally, in our office, we are seeing very similar results. It's most effective for moderate to severe post-traumatic stress and moderate to severe anxiety. But even folks like we were mentioning earlier, they're kind of on that mild side, early symptoms. We've seen a lot of positive response with that. And the nice thing is, even though this block that we do is a very temporary block, the benefit continues. So the block just resets the system, but once that system is reset, you can maintain that benefit for months, years, sometimes indefinitely. And that's some of the studies that we're doing now is looking at how long this benefit can be maintained. Some folks need this block done a second time or third time, but many, the majority, in fact, get it done once and they are doing well for a long, long time.
Wow.
Yeah,
They just
it's
kind of
it's
needed
really
a hand.
remarkable, and I know you've seen some of the testimonials and the patients, and it's the crazy thing is it's not something that a lot of folks know about. I mean, I talk to mental health providers all across the country all the time, and it's one of those things that's like, oh yeah, I've heard of that. I'm kind of familiar with it. How exactly does it work? But no one is really using it to its full potential. It's best known in the VA community and with the VA hospitals, But unfortunately, just because of the way that system works now, which is a very slow system with a lot of red tape, there's not a lot of people that are available in that system to perform this treatment. And oftentimes, especially with active military, they're reluctant to even say they have post-traumatic stress because of fear of repercussions. And so I end up treating a lot of the active military that don't want to go to the veteran hospitals, which is unfortunately, that's unfortunate that that's the case, but that's the reality. And so as we're studying this more and as we're kind of spreading this information and education, it seems to be something that is gaining more and more popularity and good clinical evidence, empirical evidence to support it.
I just think that's phenomenal because
Yeah.
it's, when you're in that situation again, you do feel like no one understands you and you're all alone. And to have that light there at the end of the tunnel, to me, it helps a lot. Like, okay, I can get through this. I can, because there's help for me. It's when you don't feel like there's any help or anybody understands it. I think that's where hopelessness steps in. And and I think hopelessness will make a situation worse,
Yeah.
whereas hope can help the situation.
Yeah.
That's me.
Oh, absolutely. Hopelessness and shame and guilt.
That's right.
They're awful and they weigh heavy in all my patients. And it's so rewarding. I see patients come in and then, we'll see maybe a month later their spouse comes in for treatment because they're like, oh my gosh, I'm seeing these amazing changes, in my husband, and now I want to see those changes. Actually, I have a lovely gentleman that we treated a while back that he brought his kids in and they did a little testimonial, but he was just saying how like they have their dad back, which
Wow.
for me with four kids is really heart-wrenching, that
Wow.
they had not really had what they knew of their dad for years, and he was finally kind of back to his
Oh my
his usual self,
gosh.
which is amazing.
Oh,
Yeah.
that just does make your heart just go, wow.
Yeah.
You're true.
That's a great testimony.
Yep.
It's
Yep.
absolutely great.
Yeah,
Wow.
there's a saying in trauma recovery that healing from trauma is about rediscovering who you were before your survival instinct told you who you had to be. And that's what we see. We see these folks that are just going on this survival response 24/7, and it's just not who they are or who they were meant to be. And it really, puts them to a point where their real self can come out, and it's a
Right.
remarkable transformation.
Well, the work you're doing is amazing. And what's the cutoff where you say they can't get the treatment? What do you see as specifically where this is really not PTSD and there's other measures to go first before going to this treatment?
Yeah, so there's not necessarily a cutoff per se, but what we do often see is the folks that are coming to me are folks that are usually they've done all the traditional treatments, right? They've probably done cognitive behavioral therapy. They've done different types of trauma therapy, such as EMDR or specialized treatments. They've done medications, they've tried mindfulness and yoga and meditation, and they usually come to me at that kind of, this is the last option, unfortunately. Um, so it's rare that I'm seeing someone that's coming in and says, "Oh gosh, I had no idea I have post-traumatic stress and I've never been treated for any type of mental health issue before." That's very unusual.
No.
That said, we screen all our patients ahead of time. We have a patient engagement team. We have objective assessments that measure levels of post-traumatic stress and anxiety and depression. And, we even do the consultation if needed ahead of time, so the patient has a good understanding of exactly what we're doing. But yeah, it's rare that someone comes in that hasn't had some type of treatment before.
And if they did, then to cut them off is basically where they haven't tried some of these things, right? Because you consider this as one of the last steps, right?
Well, that's what we see. But the reality is, this really is the first step. That's what you really
Mm.
have to think of it as. You want this to look like the starting line. Because what we're doing, again, is we're changing someone's physiologic reaction to stressors or triggers, which allows them to then incorporate those traditional treatments more effectively, right? So if someone's sitting at a 9 out of 10 all the time, it's really easy to get to a 10. And all of a sudden, something sets them off, and whatever their 10 is, maybe it's frustration, maybe it's restlessness, maybe it's a mental breakdown or depression. Whatever their 10 is, it's really easy to get there. Now, if we reset that baseline back to a 1, that gives them time. It provides space for them to take a deep breath and actually have it impact them positively, right? So they can recognize a stressor and then move forward with a healthy coping strategy. And they're not immediately going to a 10, but it doesn't prevent you from getting to a 10. You still can. You still have choices to make. You still have healthy and unhealthy coping strategies. So if you look at this as a finish line, you're probably not going to have a great long-term benefit because you're going to think, oh, I'm all fixed, I'm good to go. And now I can just ignore all the stressors and do whatever I want because my body's healed. Well, just like a broken bone, you can certainly re-break it, right? Just like an
Yeah.
injured back that you fix, you can certainly re-injure it if you're doing the wrong things. So it's all about doing the right things after this. And just like any injury, if you rehabilitate that injury, if you strengthen, then you're far less likely to re-injure it. So while unfortunately it is the case that they're usually at the end of, their treatment line with me, I really re-educate that this really needs to open the door to all those other treatments being looked at again. And unfortunately, they've often said, I've given up on therapy. It didn't work for me. I get that. I really do. But it makes sense, if you're constantly feeling like you're running from a bear, well, guess what? Taking a deep breath probably isn't going to make you feel any better, right? But if you don't feel like that anymore,
Mm.
then taking a deep breath actually works. Doing cognitive behavioral therapy actually becomes a really effective treatment, as it should be.
So once you get this treatment, you could have it a second time, correct?
Yeah, and we do have patients. About 20% of patients that respond to this treatment need it again in the future, historically. That's the data that we're seeing. There's no contraindication to doing it. Usually it depends on the amount of trauma that they've been through, right? If there's a lot of layers to that onion, so to speak,
Hmm.
and we're kind of unwinding those layers, then sometimes treatment is sort of a stepwise progression,
Okay.
right? They're starting up here, they get better, they live at that level for a while, maybe work through that trauma, work through that mental health, for a bit, and then maybe need another treatment. So that does happen.
Interesting. And I could tell that a lot of men, I'm going to talk about men in anger, have not been taught you don't have to always blow your gasket when you're upset.
Yeah.
It's not good for you.
Yeah.
And
No.
and down the line, you're going to intimidate, and it gets worse and worse and worse unless you fix your anger issues. It could cause you relationships. It can cause business opportunities. It can change in so many different aspects. So I kind of take a deep breath when I'm upset and just, okay, let me walk away, not think about this. I am upset, but I'm not going to react
Yeah.
and be.
Well, absolutely. And it also comes usually kind of like you're alluding to. It comes from layers and layers of, lack of emotional understanding, sometimes emotional neglect as a child, or even verbal or physical abuse. I mean, there's certainly a number of people out there, particularly I think more in our generation, but where, our parents would spank us and then say, "Oh, I'm doing this because I love you." Right? And then you wonder why they have some emotional disconnect in relationships down the road. I mean, it kind of makes sense. And again, that's a simplified example, of course. But if you compound that again and again and again and again, it becomes very difficult for people to develop healthy relationships.
Okay.
And do you
Well,
think it?
Gotcha.
Sorry. Do you think
No.
it's also could be like even a learned behavior that this is the way mommy and daddy deal with problems, so therefore this is the way you deal with problems, and it just
Yeah,
gets passed
yeah.
from
I mean,
generation to
our
generation?
absolutely. It's a generational trauma, and usually it's much more significant than a spanking. But I'm using that as an example. But often it is very serious neglect or abuse. But in general, our mental health is based on three pillars of love, support, and safety. And if there's any fracturing of any of those pillars, it really makes a healthy balance going forward very difficult.
All right. Perfect. Where can people find info on you? Where's the best place?
Yeah, so our website is probably the best place. That's the resetcenter.com. So we have on there information about all our treatments because we do other treatments too. We do IV ketamine, we do treatments for myofascial pain. So we have a number of options, and they can get all that information, see testimonials, and sign up right directly on our website. Or our phone number is 877 Reset 10, and you can call us directly also.
All right. Thank you very much, sir. And go to storehousemediagroup.com for all things media and marketing. Appreciate it, guys.
Thank you.